So now we're going to look at taking a catheter specimen of urine. So as you can see, I've got my sterile field and my sterile gloves on. I have got this piece of paper from putting my gloves on, so I'm just going to move that out of the way by grabbing the middle of it that's not contaminated. And you can see I've already opened my swab, which is 70% alcohol and 2% chlorhexidine. So I'm going to use that to swab the catheter port where I'm going to take my sample from. I've got my syringe and needle that I opened and popped on my sterile field earlier. So that's ready. Okay, so I'm just going to take my swab and give the port a clean. Okay, Beryl, I did explain to you what I was doing, didn't I? Just to remind you, I'm just taking a bit of specimen of urine from this catheter, and we're going to send it off to just check that there's nothing growing in it that might cause you an infection. So we're just going to leave that to dry to take effect. So 30 seconds. And then I'm going to take my needle and syringe. Now don't worry, Beryl, this isn't going into you. This is just going into this rubber bung. And then pop it into the rubber bung carefully, without stabbing yourself preferably, and aspirate to get the sample of urine. Now 10 mils is ideal, but sometimes that might be difficult. If there isn't any urine in the tubing, it might be that you use a special clamp at in the tubing to ensure that you get a collection and a reservoir of urine. So I'm looking at what the urine looks like as we're aspirating back, because it's important to know whether this is cloudy, if it's got any detritus in it. So when I've got as much as I can get, I'm going to remove the needle, re-swab that port, and then safely resheath this needle onto a firm surface. Okay, so now I'm in a position where I can fill my catheter specimen pot, get rid of that needle into the sharps bin, decant the urine, get rid of the syringe, and then we're in a position to get that labelled with the correct patient details and get it sent off to the lab within 4 hours preferably. If it's going to take longer, it should go into the refrigerator. And that's taking a catheter specimen of urine.